So the most common type of exam that you're going to see or hear about in CT is going to be the CT head without contrast. I'll say that again, the most common exam is going to be the CT head without contrast. As you saw earlier, stroke is one of the number one reasons why we utilize CT. So if someone is experiencing a stroke or stroke-like symptoms, we're not going into X-ray to go shoot a skull, we're not going into X-ray to go look at a chest, we're going straight to CT to do a non-contrast brain, okay? Also, we talked about, what was the other one? I said stroke, cancer, right? Cancer is another reason why we would start implementing CT. When you think about radiation therapy, what is combined with radiation therapy? What kind of imaging modality is fused with radiation therapy? CT. It is the CT machine. Okay? All right. Awesome. Y'all are with me. I love it. Yes?
So like when you do the CT, because you know how sometimes they'll bring in like a trauma patient or from like a fall, they'll order all the extremities, but first they always want to go, they'll do like a chest and pelvis, but first they want the CT, and then they want all the x-rays.
That's going to be for the trauma, and usually what type of CT is going to be requested? Not the whole body.
Just, I don't know.
Most time it's a hands.
What's
Yeah.
a hand scan? Because that's a specific area.
Like pelvis to head.
Oh, so it's not the extremities that they're doing, like.
This is actually learning from when I was X-ray tech.
No, it shouldn't be the extremities.
No.
Yeah, it's like a head.
Usually it's just the head.
Like a
Yeah.
whole axial skeleton, just to see if there's any probably fractures or breaks or anything like that. And that's probably a new protocol, because that was not a protocol when I was scanning. But it's been a minute since I started, since I was scanning. So.
I just know in the shop when they be like, just order a pan scan.
Mm-hmm. I thought that was like maybe the whole body or something. Like, I don't know.
I'm assuming pelvis.
Every time somebody comes in for a call, they do a pan.
FOM,
Yeah.
or MBA,
Mhm.
and MBA too.
Yes, for internal bleeding. It's always for internal bleeding.
That's without contrast, correct?
It's with contrast.
Well, it just depends on what they come in for.
Got it. So when y'all go to clinic this week, what's a pan scan? And I think in this book, and we're gonna go over the literature too, because I wanna make sure before I move into the physics, which is gonna be covered in this next video as well. I do know that PRE or physics, principles of radiation exposure or physics, X-ray physics is going to be covered a lot. It really is the foundation, because we have an X-ray tube in the gantry, in the machine. So how the X-rays are formed, we need 3 steps. So we're gonna talk about another 3 steps. So hopefully it's gonna kind of start refreshing your memory moving forward.
Which produce just 2 dimensions of image data, which are acquired from an X-ray source. CT scanners actually create 3 dimensions of image data that we call a volume of data. And it does this by acquiring projections from all around the patient as opposed to just one view. This means, of course, more radiation dose to the patients, but it also means significantly more information is available to make a well-informed diagnosis. The images that you see on the screen are examples of how a CT dataset can be reconstructed or reformatted to be projected from different imaging planes. The first image is the traditional axial view, the second image is the coronal view, and the last image is, of course, the sagittal view. Not surprisingly, CT has really created quite a niche in the world of diagnostic imaging, and one of the reasons of this is the addition of contrast-enhanced imaging, which gives us the ability to distinguish internal structures that otherwise might have been invisible to us. The 2 images that you see on the screen are of the same patient at the same slice level. The image on the left was performed without contrast, and the image on the right was performed with contrast. Without contrast, this large kidney mass, which is called a Wilms tumor, is really poorly visualized. You can see something is there, but that's just about all you can see. In the second image with contrast, This mass and other abdominal structures are much more clearly defined because of the contrast enhancement. So how exactly does a CT scan produce images? Some of the basic principles of CT imaging are actually very similar to the general principles of radiology.
What generation is this? Are we second guessing ourselves, guys? Are we? Lexus, you were right. Why is this the third generation? Because it's a fan beam one. Hold on, guys, I need to catch my breath. A fan beam is one indicator. And why is this not a fourth generation?
A ring of detectors is what it is.
Because it doesn't have a ring of detectors. It doesn't. What you see is the fan beam aiming at some detectors. You're gonna be like, is it two? That looks like a little bit more detectors than it would have been for two. Okay? So this is a third generation, which is what we use today in our clinical sites. They're gonna tell you, the techs are gonna say, oh, it's a Siemens. It's a Philips. I'm like, but no, is it third generation or like, probably missed that part. But it's important to you. Once you become a CT tech, you're like, it's a Philips, it's a Siemens, it just 164 slices. That's fine after that, but this is a third generation.
Photography, especially the idea of X-ray attenuation. As the X-ray beam spirals around the patient, a large fraction of the individual X-ray photons are absorbed by the body or deflected out of the scanner. The remaining X-ray photons pass through the body and help to create the digital profile of the patient's internal anatomy.
Alright, now this is where we're gonna get into physics. And I need this imagery. This is why it's really important. One, my purpose of going through this is one, you won't be so far behind when you do get your Cobra license. You've already seen the videos, you know what to expect, right? And you can catch up. Two, as we're moving into radiation, physics. I've sat there and I've done my beautiful drawings, but I don't think you can do it as much justice as this. These are wavelengths coming from the X-ray source, right, which is the tube. Look at the wave quantity. How many waves from the X-ray source to the body? The more waves you have in that distance, the higher the energy. So this symbol of each wave, and it has closer and closer crests, troves, or crest and valleys, whatever you want to call it. When they're closer together, the energy is higher. That means more frequency per second. Okay? Now, we talked about the word attenuation. Help me, who remembers what attenuation is? Birthday boy.
Attenuation is how the beams are stopped going through matter, depending on the density of what's
Just stopped.
absorbed.
Absorbed, which would be stopped. Or
Deflected.
phone a friend. Please, this is a democracy here. We can phone friends. We love each other. Y'all are a small class, but a mighty class. Phone a friend. Keep going. Let's go around the table.
I know.
What is attenuation? He said absorbed and
Standard.
scattered. High five. Yes. So, as the radiation is being aimed at the patient, right? Because we can't move the patients anywhere else other than the table. We set them on the table. The table's pretty narrow to fit into that gantry space, right? So we aim at the patient. Look at the differences between this wave entering the patient. We know that something is happening, right? And look at the wave frequency afterwards. What's the difference between this wave and this wave? Based on what I just said. Romer.
Well, after the patient, they are a lot longer, the frequency, and it looks like he has less X-rays.
You have less x-rays.
Mhm.
Okay, alright, good.
They're more spacious in the field.
Okay, I like that. Anybody else have anything to add?
So basically, the X-rays. Oh, I don't know if you. I think it's. So yeah. So the image just kind of shows they've been attenuated, and so what you're seeing is just the leftover.
Perfect. You said it on the mark. Here is the X-ray beam intensity. This is the X-ray beam, collective as a whole, all of these waves together. There's a patient in the way. So some of these X-rays, because we know that they're photons, right? Their energy passing through the body. They're gonna bump into, and then get lost in, right? Something that's very dense, and it's going to absorb it. Not enough energy to pass through it. But the energy that does escape is carrying information with it. What information is it carrying with it? It doesn't have a pocket. It doesn't have anything to put this information, but what energy is it carrying with? So, this is going to lead us up into physics. You're like, this is too complicated. If anybody needs to go get coffee, we have a coffee bar on second. We can all walk together, take a field trip, go get some more coffee. But this is part where it's going to get real, and I need you to hear, okay? We see that the frequency waves, the crests are closer together in proximity. The closer the crests are together in proximity, we know that the energy is higher. That's just the symbolism. As the crests start to get further and further apart, we know that the energy is less. This is the X-ray beam. This is the remnant beam. This is the X-ray beam. This is the remnant beam. The remnant beam has already passed through the patient. The energy that was either stopped, absorbed, here in between, because if it was absorbed, there is no radiation to be in the remnant beam. If the energy went into the patient and exited the patient, it is not carrying the same energy punch that it did going into the patient. Depending on what this energy collided with in the patient and exited, it does not carry the same energy. But because these wavelengths, or this analog wave, is being captured by the detector, a number is going to be assigned to the intensity, the energy. The intensity of all of these beams, right? Because intensity means quantity. That kind of remembers. Remember, we're talking about MA. Milliamperage in time talks about how much X-rays are released from the X-ray tube, but the energy is how high the energy is. Is it 90 kVp? Is it 100 kVp? Is it 125 kVp? Right? That's the energy. Intensity means quantity. Energy means the punch. And that's what we said. So we're going to talk about kVp, we're going to talk about MA. But here we have the X-ray beam, pre-patient, the remnant beam, post-patient. The X-rays that were absorbed will deposit no energy, and a value will be assigned. The energy that deposits onto the detector is going to be assigned a value based on the amount of frequency or energy that is there. Is everybody with me? It's okay for me to repeat it? Yeah. We have the X-ray source. We have the X-ray beam. We can see the frequency. So if we counted how many crests we have here versus how many crests we have here, we know that there is an energy difference. And it happened because the patient was in the way. Attenuation of an X-ray beam is either being absorbed by the body or it's being scattered by the body. It's either being absorbed by the body or it's being scattered by the body. If it's absorbed by the body, the detector will never receive the energy and therefore assign a value. This is why bone is white. This is why we have different shades of gray. Because these energies are being quantified based on no photons made it to the detector. Photons made it to the detector. So when you see white, it's just an outline of the bone that absorbed all of your X-rays. When you see white, you just see a vacant spot on this image because no great x-rays made it through this portion of the body. It's absorbed, it's blank, it's a blank slate. Think of it like a canvas. If you don't paint on the canvas, it stays white, correct? It's void of any information. But when you paint around it, you can see the outline of what was there and make a distinct visualization. Oh, that was the vertebrae. You with me? Make sense? So, pre-patient X-ray beam, post-patient exit radiation or remnant beam. Exit radiation or remnant beam. They're synonymous. Good. We're gonna get into this. The videos will be a little bit more, but I'm hoping that you're getting to see the wavelengths because I'm gonna talk about wavelengths and the frequency. The shorter, more crests in a shorter period of time, the higher the energy. Less waves in that same amount of time, the less the energy. Okay?
I have a question.
No.
You said that the remnant beam is what they get assigned a number, right? So
Yeah.
that's like that binary code that y'all.
Yeah, that'll
The
eventually
0 to 1.
quantify. Yep.
Okay.
Yep, absolutely. You're making it. 2 points. I love it. She has her coffee. I love it. I love it.
Mhm.
Just like general radiography, CT scanners detect and display tissues based on their density. Tissue differentiation in CT is entirely dependent on the tissue density, which is why we often inject contrast to make sure that we can see certain structures that other
What is tissue density? What is MSR? I'm okay with that question.
It's like bone versus soft tissue, just the attenuation that we were talking about.
You know, I love being animated. I don't know if you guys noticed that I probably act out a lot of things that I do. I don't know. It brings me joy. I don't know if it's been making a difference for you all. But let's stand up. Come on. Good. All right.
I'm sorry.
Come this way. Come see me. Oh boy. Come to me. We're gonna get close. Are y'all gonna be okay with this? All right. Spread a little bit. Spread a little bit. All right. Okay, I'm an X-ray beam. I'm gonna run right. I'm gonna pass through you. Some of this gonna get absorbed, and some of it is not. Right? Okay. X-ray beam. It goes through you. Goes through. X-ray beam. Less gets to the detector. Most of it gets scattered. Right? X-ray beam. Oh, nothing got to the detector because it got scattered or it got absorbed. I'm finding the pockets. Nothing there. Get closer. Get closer. This is compact. Y'all are compacted together. You are atoms that do not allow space to come in between you. So I can't be the X-ray beam that gets to you. Bone is compact tissue. It is strong. It is forceful. It is immovable. Spread away. Tissue has space in between it. Move further apart. Air has super much space in between it. It's not compact cells. So when you think about tissue density, how close the atoms are packed together, the cells are packed together, say cells. Cells are packed together, or how flexible they are in tissue and in water. Got it? That's tissue density. Perfect. All right. So when tissue density comes into play, yes, our X-ray beam is going to encounter some of this compact, highly dense tissue because bone is tissue, correct? Is bone tissue? Yeah, just a yes. Just go with me. Bone is tissue. So is fat. So is soft tissue. So is lung. All of that is tissue that makes us up. Got it? The more compact, the likelier it's being absorbed in the body, depending on the energy. This is why we boost our KVP, right? This is why we boost our KVP when we want to see a lot of tissue differentiation, like chest x-rays and things like that. And this is why we lower our KVP when we want to see what? Y'all are x-ray techs. What's your technique for a hand?
Like 50 at
50 at what?
1.
1. What's your chest? What's your technique for a chest? Not 50. What does 50 mean when y'all say that?
KDP.
What's the KVP range for chest?
9, 8, 5, and 4.
Good. What's the KVP for abdomen?
80.
Okay. Y'all are gonna stay in the same realm. It's not gonna go less than 70. I can tell you that right now. What's the KVP for a shoulder?
75.
Is it 75
Or a grid.
for a grid? Like now we're going into grid stuff. Okay. Do you see what I'm talking about here? Why do we lower our KVP for extremity work? What? Less? Smaller? Okay. Or do we want x-ray to absorb and just outline the bones? That's why we go less on KVP. We want less punch through on compact bone. We lower the KVP because we want to outline the bone. We want it to absorb so that we can see the bone. If we go higher on that KVP and we're looking at an extremity, guess what we're gonna get? Tissue, everything's gonna look gray, right? What are you really looking at? Not an extremity or not at the bones, you're looking at the tissue. So just rule of thumb, KVP goes up when you're looking for tissues that are very similar. The rule of thumb is you go down on KVP when you're wanting to highlight a bone and have it absorb. And so that's gonna be the x-ray phenomenon. But we're gonna talk about
KVP goes up for tissue,
KVP goes up for tissue,
and KVP
goes
goes
down for bone. Alright, so let's just get through this one. Is this kind of starting to come back a little bit? You could be like, oh, I was in school over a year ago. It kind of seeped up. That's fine. But I'd rather know that you know it now because honestly, knowing my physics is what really helped me get through that test. And teach the class when I was
Otherwise might blend in with the surrounding structures. CT is really pretty popular. The most common CT examinations ordered across all medical settings include these 5 exams. CT head without contrast, usually for trauma or some unknown pathology of the brain. Also CT abdomen and pelvis with contrast for a variety of indications. CT chest with contrast. CT abdomen and pelvis without contrast, especially for renal stone. And then finally CT angiography.
I'm just gonna go capturing that. Oh, shameless plug. I have 2 more CT positions coming up, that I need to fill, probably within mid-October. So if you guys know anyone that is interested in imaging fellow, I have 2 more positions coming, and that'll be my final 6. And luckily, I'm the CT teacher, so I can teach them. Double benefits. We good? So the most common X-ray, CT scan is going to be of what? CT head without contrast. So you're going to fill up all of your competencies with CT head without contrast. That's gonna be one of the most popular x-rays that you're going to have. And remember what Mr. Fung said. Once you get your 5 or how many you need from your CT head without contrast, start looking to see what else of the head area that you're able to satisfy with those exams, okay? I'm saying that now because at the end of the semester, when you're saying I have 50 CT head without contrast scans, could you have used those based on the diagnosis or the reasons for the exam for something else? He mentioned the pituitary. Not that we would really be doing for soft tissue, but nonetheless, okay?
Of the chest, CT of the head without contrast by itself represents nearly 25% of all CT scans performed at most institutions. CT of the abdomen and pelvis with contrast represent about 20% of all CT scans. So here's the basic facts that we need to know about CT. Number 1, CT is awesome. Secondly, CT is used for a number of indications, but it's especially important for stroke, trauma, cancer care, and several other factors. Surgeries can sometimes be avoided by CT because it helps us to see internal pathologies that used to require an exploratory surgery. CT can be reformatted to multiple imaging planes. The traditional view is axial, but sagittal and coronal views are also possible. And finally, CT displays tissue based on the density of the underlying tissues. So that's an introduction to computed tomography.
Alright, was there any questions about that? As you can see, he did not mention Hounsfield, he did not mention 1, 2, 3 steps, he did not mention any of those items there, but again, it's not saying that it's not relevant. This is just their overview. Thaddeus, this is the book source Thaddeus, that's on your syllabus. So really, it's very complimentary that these videos, are with the PowerPoints, okay? Because the PowerPoints are going to have more facts related to them, but you have a different, overview of sorts, okay? Alright, so with that, there is a quiz. So, I guess we can take it collectively. But if you're not answering, I know how to voluntold. I'm very good, I'm an expert. Which two of the following were significant limitations of early computed tomography CT scans? 2 options. Yes, Marquita.
The first and last one.
The first one and the last one. Early CT scanners required several hours for image production. Is she correct? You guys concur? Alright. Early CT scanners were only large enough to scan the head. Is she correct? Do you guys concur? Survey says you are correct. Early computed tomography scanners required several hours for image production and they were only large enough to scan the head. Who introduced the head scan? Angelica said it back there. See, we are learning in this class, despite y'all dragging yourselves in and be like, oh, Laura, can we leave right now? Not right now. Alright, conversely, modern scanners are large enough to accommodate the entire body, as we can see, and image data in less than 1 second. Modern scanners can also accommodate for the use of iodinated contrast media. Those power injectors are awesome. They're kind of scary though. Like how fast those things push in. I'm like, people don't feel it. I would think that you could feel that. But I haven't had a CT scan with contrast, so I don't know what that feels like, but it looks intimidating. Alright. For those that don't know what power injectors are, did everybody have a CT rotation on our x-ray?
The new one have the new ones?
It's the same.
The same thing? Oh,
Yeah.
the models?
Yeah.
Oh, okay. Oh.
Just to give you an FYI, I'm a little hard of hearing in this ear, so if you're asking me something and I don't hear you, just raise your voice, please, or say, so people don't believe me when I say that, but when I, she's like, she didn't hear me, I'm like, no, I didn't hear you. This is my disclaimer. Alright, what is the advantage of producing 3 dimensions of image data in computed tomography? Other than Marquita?
Dimensional image data generates higher spatial resolution.
Are you talking, who's talking? Gemini?
Oh,
Yes.
Floor plan?
The first one?
No.
Fourth, 3-dimensional image data generates higher spatial resolution. That sounds promising. Okay, so let me throw up some fingers. 1, 2, 3, 4. What we got? Okay, I'll see what. Lexus is the only one that followed instructions there. 1, 2. Go ahead, Marquita. I'll let you back in the game. Okay, so we got some ones in there. Patient anatomy can be viewed in slices without superimposition. Patient anatomy can be viewed with decreased radiation exposure. 3-dimensional image data generates higher contrast resolution, and then 3-dimensional image data generates higher spatial resolution. I am going to say, with all of the different types of reconstructions that we can create from an axial view, I'm going to follow through with the number 1, and let's see, survey says, ding, 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 ding. It is about superimposition. We have not gotten to spatial resolution or contrast resolution just yet. We will be talking about that starting in chapter 2. So the advantage of producing 3 dimensions, again, 3 dimensions, your axial, your coronal, and your sagittal. Dimensions of image data is the ability to view patient anatomy in slices without superimposition. So this is where that volume scanning data acquisition is being captured. Alright, number 3, contrast enhanced imaging is significant in computed tomography scanning because does contrast have anything to do with the radiation dose decreasing? No, and in fact it's going to have the opposite effect. Enables differentiation between similar density tissues. I see heads nodding up and down. James, I don't hear you see a head or number 2 or what's happening. Yes, following along, head is nodding. Are we good? Reduces the need for multiple imaging planes. No, it's the benefit of CT. Speeds up the scanning process. No, we're gonna go ahead and go with number 2. Since the only thing that contrast is related to is really the differentiation between similar density tissues. Similar density tissues are going to be organs, fat, those are probably the ones that are going to be in the middle, okay?
Question.
Yes,
Can you make the screen a little bit bigger?
how, can I make that?
Oh, go up to the very top, and to the no, to the
This one?
3 dots?
3 dots. Yeah, 3 dots.
3 dots, okay.
And you'll see the numbers.
Oh, perfect,
Yes, ma'am.
thank you. Walk me through that.
I couldn't see
Okay.
I'm trying to
You're
do
being
it.
brave enough. You can do that. Okay, thank you.
I was doing so hard.
Is that why you guys were quiet? Am I hearing you? Are you guys scared of me? Thank you, James, for being brave. Alright, we're gonna go with enables differentiation between similar density tissues because that's the only reason contrast is being introduced when you're trying to see something to separate tissues. So like we saw in the exam of the liver, we would not be able to see those radiolucent or those contrast areas because they blended with the liver. So, perfect. Alright, next one. What we got? We have fingers going up. I hear 3. I see some 3s. Alright. Armor. Okay. Both detect and display tissues based on density? Absolutely, because group, right? So this is X-ray. Perfect. Love it. Sometimes these questions, they just kind of want to trick you, but don't overread some of them, right? You start associating that. All right, next one. Which computed tomography examination is most commonly ordered, representing nearly 25% of all CT scans at most institutions? Romer.
The head without contrast.
The head without contrast. Perfect. Yep, we got that one. All right. Next one. What came in second? Can you remember? The abdomen, Angelica, yes. With contrast or without contrast? With contrast. Perfect. What is the primary advantage of computed tomography imaging in the diagnosis of a ruptured aortic aneurysm? This is talking about a primary advantage of a computed tomography imaging in the diagnosis of a ruptured aortic aneurysm. That is soft tissue, is it not? Yes. So you're thinking, oh, well, three-dimensional superimposition. But when you go down, you look at the opportunities. This is so back there. We know that is so posterior. CT imaging allows for diagnosis without invasive surgeries. CT imaging allows for diagnosis at reduced radiation dose. CT imaging allows for diagnosis and treatment within the same procedure. CT imaging allows for diagnosis without the use of iodinated contrast. Not that we would use iodine with aneurysms. We are definitely not opening this person up, and a CT allows us to do what is called exploratory type surgeries, where people back in the day would open people up to see what's happening in there. We don't have to go to those extents anymore. CT allows us to do that. All right, moving forward. Okay, what characteristics of computed tomography imaging allows for the reformation of images into axial, sagittal, and coronal planes? This is really going to depend if I cry or not. No pressure. No pressure. What's on the fence here? Hmm? One and four are the ones that are throwing you into that. So if you can only pick one, what characteristic of a computed tomography imaging allows for the reformation? This is reformation. We used another word. We called it reconstructed, right? Of images into an axial, sagittal, and coronal planes. You have to have the collection first in order to reconstruct. X-ray is a polyenergetic beam. We know that there is going to be a 30% difference between the X-rays that come out of that X-ray source, right? They can only peak at your KV peak setting. However, there's going to be energy ranges. So this is applies to both X-ray and CT. The question asked specifically about computed tomography. So great work. I like the analysis there. Very good. All right, perfect. Moving on. Now, what is the primary purpose of administering iodinated contrast for computed tomography imaging? Guys are saying it loud and proud. That's giving me goosebumps. I love it. All right. Which of the following images represents a coronal plane, Sindhu?
It's B.
Is it B, coronal plane? Do we agree? Perfect. Okay. All right. And we are on our road to making 100 here. What imaging factor has improved the visibility of this Wilms tumor in image B? Let me go ahead and go with Samantha.
What factor? Oh, for the contrast media.
Contrast media only. This is tissue differentiation. This whole liver looks like it's homogeneous, meaning it's just one color, right? Even though little specks are sitting here and we're like, I can't tell. But once we have some iodine absorbed into that tissue, we are now able to see, identify, or differentiate between what was homogeneous or one color into various colors, therefore giving a better diagnosis that something is happening there in the liver. Make sense? Perfect. So are we on our way to getting 100? Yes? What? I love it. See the results. I gotta see that 100. Should be proud of yourselves. Good. We passed the overview. We are officially done with the overview of CT. And so now let's go to the next section. Let's take a quick 10-minute break, and then we're gonna come back and see radiographic physics. You have the PowerPoint for number 2, correct? Have you